Hi, my name is Dennis Ruah Kamau. Um, have a career in customer experience. I have about 5 years customer experience. Currently, at the moment, I'm not employed. Looking for a job, and that was part of my crucible moment because I lost my job at the end of 2019 in December. I was working for a petroleum company, and I honestly did not think I was going to be fired. So it came very unexpected, and so I really had to adjust accordingly because I was working for a project in customer service and I was doing really well. But unfortunately, I was part of the team that I was part of the contractors that had to be let off because the company was letting off contractors. So moving from a point of where you are a lead project coordinator, and then after a year then you are let go, so that whole transition came quite a bit of a surprise to me. But the one thing I learned was that always prepare for the unexpected. You also need to be very fluid. You also need to be very adaptive. So if one door closes, you need to take advantage of the opportunities that you have. I gained quite a lot of experience to lead teams and work with a lot of departments, improving my intercommunication skills. So the project was quite new even for the company, but I was able to even get an award for it from HR. So I would say part of being given the responsibility of heading a whole new retail project in customer service was quite fulfilling and eye-opening for me. Now, losing the job, I had to adapt. I discovered that I also have other opportunities that I can delve in because I went back to writing. I've always had a passion for writing. I write articles on customer service and customer experience and the new advances in customer service leading to customer experience, especially using online presence. Um, I would say I've also gone back to programming. I'm learning new languages. I also have a passion for photography. So being a writer, I'm passionate about cooking, passionate about health. In fact, another part of my crucible was I lost my dad in 2013 due to leukemia, and my mother also has multiple sclerosis. So health is quite big in our family. So those two are part of my crucible moments. What are the opportunities to innovate? I think there's a very big opportunity in telemedicine, including digital tools beyond audio and visual. There's now Zoom meetings. You can use even the USSD codes for patients or nurses who are in the rural areas. I think another area that the Ponea Health can really take advantage of this is in offering video conferencing and other digital solutions, especially in data gathering and research. Um, Also, come up with a training app for nurses, and we need to give more information to the public out there because there's a lot of information and misinformation on the COVID-19 measures. So I think there's a lot of partnering we can do with other key players. Teletraining, maybe training apps for nurses, and we also tend to the vulnerable demographics like the elderly and the sick. We need to tap into other areas to improve customer service online. Come up with the latest advances in web design and data science and analytics. We need to come up with something that we can be proof checking on the current medicines that we have and the health facilities. We need to sensitize people more about this COVID-19 and also this area of teenage pregnancies and also some of the health issues that are coming up about maybe due to natural occurrences like flooding, because maybe there'll be bilharzia or cholera. Global change is really affecting our population in terms of health. So I think these are some of the areas we could really tap into. Yeah. And lastly, the changes in the socio-economic setting, like if COVID-19 has affected the Kenyan population, how has it affected their livelihoods in terms of occupations or stress, mental health, what foods are they eating, what are some of the psychological effects. So these are the areas that I would really wish to partner with you guys to improve on Ponea Health. Thank you.